Well, I have been making videos about the latest changes what Gina has brought in for 2025. They have also made a significant change in the section 12, and that is the management of worsening asthma and exacerbation in children less than in children 5 years and younger. Previously, there was uh, no word wheezing, which used to be management of worsening asthma and exacerbations. Now they have added a newer terminology, and that is wheezing. So that is to include a broader category of children. So Gina has been very thoughtful all these years, and this year has been no exception. With the evolving science, they have made great strides. And in the exacerbation of symptoms, there is nighttime cough, lethargy, poor exercise tolerance, poor response to SABA. But this time, for 2025, they have added breathlessness during they have also added breathlessness, which could be in the sleep, even crying and laughing. And they have also given importance to the audible wheeze and use of accessory muscles, which was not there. So that means they have expanded the symptomatology for 2025. And then the greatest change what Gina has brought in for 2025 has been in the bringing out more clarity when a child should be recommended to visit the hospital. This is the biggest change what Gina has brought in. There has been a lot of confusion wherever we would go for a workshop or a asthma treatment modules or advanced asthma courses. This has been the most contentious issue. Urgent care, if more than 4 puffs in less than 4 hours. So that is a clear cut recommendation. And next, they have also added another section, that is use of SABA 1 puff more than 3 times in again in 12 hours. That is again a recommendation to visit a hospital. So this is where they have brought in more clarity when a child should be visiting a hospital. And then they have also given the escalation. When should you be visiting a hospital in a better way? And that is the general guidance only was written in the previous GINA. Now they have given you can give 2 puffs every 20 minutes up to 3 doses. That is for the emergency management at home. Previously, what we discussed was when to visit a hospital. In case if you are unable to visit, this is what you can do at home, and that is to give 2 puffs every 20 minutes up to 3 doses. Okay. So previously it was arbitrary, it was very confusing. Now we have more clarity. That is, if the child doesn't respond to 6 puffs in less than 1 hour, that again is a very emergency situation. You need to visit a hospital immediately. And then in the primary care facility, there was again changes what Gina has brought in, and that is there used to be 2 to 6 puffs in of every 20 minutes in the first hour. Now they have made 3 times, 4 to 6 puffs at 20 minutes intervals for 3 times. So that is the change what we see. Instead of making it a arbitrary of 1 hour, they have made it as 3 times, because there can be delays, there can be some misappropriations. So to make it a clearer thought, what they have given is in 3 times. No, that is what you should be doing it for 3 times. That is the change what Gina has brought in for 2025. And they have also given a thought about ipratropium, which can be added in case of emergency situation. That is 4 puffs every 20 minutes, 3 times. So there is a clearer guidelines when it comes to ipratropium bromide in its emergency purpose. And then the most welcome change what we can see for 2025 is the taking out of the nebulized magnesium sulfate and bringing in the intravenous magnesium sulfate. All these years there was a lot of confusion what to give, what not to give, because Gina was not very clear in the usage of magnesium sulfate. But all in our asthma treatment modules and advanced asthma courses, we have always emphasized the importance of magnesium sulfate in emergency purposes. 40 to 50 milligrams of magnesium sulfate per kg to a max of 2 grams is what can be used in emergency situations to abort a acute exacerbation of asthma. So this is another important change what Gina has brought in. Okay. And there was a lot of confusion in the oxygen saturation maintenance. Previously, they had a target of 94 to 98%. Now they have made very clear any saturation less than 94% should be taken as a significant hypoxemia. And of course, there is some discount if the person is staying in a high altitude, because the saturations will obviously be lesser in that part. And there has been no change in the oral corticosteroid, whether at home it is, which is not recommended, at hospital settings, that is 1 to 2 milligrams of prednisolone per kilo body weight. So there is no change in any of that. And of course, there has been some changes in the discharge and follow-up and the caregiver education, that is the home action plan of asthma, has been well expanded in this section. These are some of the nitty-gritties what you can see for GINA 2025 in the management of acute exacerbation of wheezing in children 5 years or younger.